Hi Jonathan, I'm Dr. Parker. I'm really glad you're here today and I'm honored that you've chosen me to be your chiropractor. I noticed that Cindy referred you here.
Yeah.
We really appreciate her for referring us their friends and family, and I intend to take such good care of you that you will want to refer your friends and family to a chiropractor. Let me begin by saying thank you for doing such a good job at completing the entrance questionnaire. I know that process can seem tedious.
Yeah.
I reviewed the information in your file and I came across a couple of things that I would like to discuss with you. But before we get into that, I just want to explain what we do here in the office.
Awesome.
How familiar are you with the function and components of the human body? Alright, that's okay. Do you remember learning about the nervous system?
Oh yeah, I get nervous sometimes.
Well, the nervous system is considered to be the most important system in the entire body. The nervous system is essentially the body's electrical wiring. It's a complex network of nerves and cells that carry messages to and from the brain, the spinal cord, and to all parts of the body. Now, in order for me to help you, Jonathan, it's my job to locate, analyze, and correct vertebral subluxations.
What's that?
Well, a vertebral subluxation, utilizing the spine model here, is basically when two bones are no longer in alignment, or they're not moving properly, and that begins irritating a nerve. And I've noticed that subluxations can occur at any time, even in early childhood. Most children, however, have one or two subluxations due to minor falls, playing sports, or even the stress of a normal birthing process. And typically though, they're asymptomatic, meaning that there's no pain associated with it. However, at that particular joint, a muscle will start to spasm or splint to protect that nerve, and that's going to cause a decreased amount of normal motion. Just to better understand this concept, I want you to think of telephone lines. Now, the nerves in the spinal cord are a communicating pathway between the brain and the body. Now, utilizing this poster here, the brain is going to be, think of it as the master controller of the body. So every move that you make, the brain is going to coordinate and implement that movement. Okay? So a subluxation is like when that telephone pole falls down. Those phone lines can no longer transmit or receive messages, exactly like a nerve. And when that nerve is irritated and that subluxation is not corrected, that nerve can experience nerve degeneration, meaning that that nerve can no longer transmit signals to and from the brain or from the body to the brain. So, my patients come in and they're experiencing numbness and tingling, weakness and coordination, aches and pains, spasms and cramps, a number of things. And these symptoms can occur anywhere in the body that the nerves go. For instance, the nerves in the neck are associated with your head, your neck, your shoulders, your arms and hands, even your ears, nose, and throat. Now the nerves in the mid-back are going to be associated not only with the mid-back, but the chest area and the organs within the chest, such as your heart, your lungs. And the nerves in the low back are going to be associated with your legs, your feet, your toes, your kidneys, your bowels. And let me just point out that if the nerves in your body aren't working properly, then your body isn't working at 100% either. Now, 90% of my patients come into my office having aches and pains. And once I'm able to locate and correct those subluxations with repetitive chiropractic adjustments, I'm not only able to decrease that amount of pain, they start to notice positive changes, such as their hearing improves, their vision improves, their blood pressure drops, their asthma starts to improve. A number of things. They just start feeling positive in general. Now, like I said before, Jonathan, in order for me to help you, I want to conduct a series of exams. I'm going to conduct an orthopedic, a neurological, and a comprehensive chiropractic exam. And I may even take a series of x-rays to view the condition of your spine. Now, after doing all that, I'm going to come up with a written report that I'm going to give to you tomorrow at 10 o'clock. Now, it's very important that you bring someone with you to the appointment tomorrow, just so they understand why you're seeing a chiropractor and the benefits of chiropractic. Chiropractic can change your life. Chiropractic is about helping the body function at its very best. It's about addressing the root of the problem. Now, do you have any questions? All right, well, let's get started.